Pleasant good afternoon to everyone. Before I start, I would like to pay special mention to two people who I think were very instrumental in the movement of CARPHA in the last 2 years. You see, in 2011, I became the Minister of Health of Trinidad and Tobago. At my first visit to Washington, I was faced with the Ministers of Health meeting as well as the pre-meeting prior to it. I took it upon myself to go to the pre-meeting, and there I learned a lot about what CARPHA was about. I heard about the length of time that we were developing CARPHA. I heard about other things. And with me was my permanent secretary, now former permanent secretary, Ms. Antonia Popwell. I would see her in the audience. I would like to pay special mention to her. And Dr. Leslie Ramsamy, and I would like to tell Dr. Ramsamy to indicate that to him. One other person who I neglected to mention would be Dr. Anton Kamabach. He was our chief medical officer at that meeting, since left. The reason I call those names, it's as simple as this. Dr. Kamabach indicated to me, I said I was thinking of going to the pre-meeting of the Minister of Health. He said, I think it's a good idea for a minister, because you'll hear a lot more that you'll hear tomorrow. So I went it, and there Ms. Popwell was there, Dr. Ramsamy was there also, and we all listened to what this CARPHA thing was about. It had been on the back burner for about, I think, 10 to 11 years. When I heard it, being a doctor, and previously I'm a surgeon, and also I worked in public health, I realized that, and we've heard about it this evening, you had 5 arms. You had CAREC, the surveillance arm, epidemiology. You had SEHI, the environmental arm. You had the CFNI, the food and nutrition arm. And you had the Caribbean Regional Drug Testing Lab. All of it separated by water, sea. We are CARICOM, a CARICOM nation. And I saw an opportunity to build another West Indies team. And as you all know, the West Indies were and are still a very good team. So, in fact, we have a lot of cricket in the next couple of days. I invite you all to stay and welcome you to Trinidad. But when I saw it, I realized that, like the fingers of a hand, you have 5 fingers. But has anyone ever tried to lift something with one finger with all the others? It can't work. So CARPHA represented to me fingers of a hand working together to develop movement forward. And I took it upon it, and I came back to the Prime Minister, the Honourable Kamala Prasad Bisesa, and I indicated to her that there is this thing called CARPHA, and she said she knew about it because she's at the heads of government. And I asked Prime Minister, can we just put an effort to move this thing forward? And she said, Fuad, bring a note, which I did. I carried a note to the cabinet, and it was passed thanks to her, without no FNGPs. And from that day onwards, we started to move it forward. And I want to thank, the reason I want to thank Ms. Popwell, as good permanent secretaries, you know what they do? All the work. And as ministers, we stand up and speak about the work that they do, while they sit in the audience together. I see my other permanent secretaries of program here. Well, thank you for being here. And Ms. Popwell stood on together with Dr. Kamabach and Dr. Ramsamy and then Dr. Ramsaran. They all went together. We hosted CARPHA here, the CARPHA meetings here, a couple of meetings a lot. And we were able to develop the movement forward. And when Dr. Ferguson came on board, he's a very dynamic Minister of Health, and I want to thank him for being on board with us, Dr. Ferguson. He really carried it forward. So then, after that, I decided to take a little rest, and everything became one unit. Then we had Dr. Roses, Dr. Socorro Gross, and Dr. Etienne. I met Dr. Etienne at the, I think, with the World Health Organization meeting in Geneva for the first time. And I indicated to her, well, she said she was from Dominica. And I indicated Dr. Etienne, I said, well, you know, I'm the new Minister of Health of Trinidad and Tobago, and I would like to push this CARPHA. She said, she will help me push this CARPHA. And I'm very glad. In fact, when Dr. Etienne came and sat down, I said, I'm so glad you said those words, that you're going to take the CARPHA and run with it. So we are going to have, now she's director of PAHO, and we've always gotten a lot of support from PAHO. Now, it is important to understand the history behind it. Because once we understand the history behind it, and I think Dr. Douglas will tell you much more than I can, because he was there from the start, you will notice that once you know the history behind something, the forward movement and the awareness and everything else will go forward. And as Dr. Hospitalis said, we are faced with a multitude of illnesses. Recently, coronaviruses, such as are similar to SARS in United Arab Emirates. You have SARS somewhere. You have cholera in Haiti. You have cervical cancer. You have a lot of things in public health. And public health, as we all know, is a dynamic specialty. You can go to sleep normal tonight, and tomorrow morning get up with a full-blown worldwide epidemic of something. It could happen. Ebola being contained in Eastern Africa. CARPHA together will be able to develop the research capabilities, the surveillance methods, whatever you think it may be, to determine the promotion, as I say, of surveillance, control of those disorders. And we need it. And I'm very happy to see the ambassador for Argentina here, because Argentina has come on board a couple of times with their Vice Minister of Health together in Trinidad, as well as in Geneva, and we spoke about CARPHA, moving CARPHA forward. Brazil is coming on board, Canada is on board, United States, CDC in Atlanta, England, and then we have the European Union. And they have all chipped in to say, we are going to develop in Trinidad and Tobago our own CDC called CARPHA. And that is what it's about. When you look at it, it's going to be a whole significant developing public health agency. Trinidad is happy to host it. We have 3 sites. Now I think Dr. Ferguson will be going to visit some of the sites, because I need some input. Where is the best place to put CARPHA? It is going to be located either in Cora Valley, either in Federation Park or Valsay, which one is most acceptable. We have the UNOPS people. They have done a study on all the areas, and we have to sit down with the CARPHA board and determine exactly where it's going to be. Now, I don't have much time, but I'd like to put a plug in for this. Whenever I see Professor George Aline, I feel good. Because you know why? Professor George Aline taught me in medical school. And we always looked up to Professor Aline as being, yes, that is a man of the Caribbean, and we're so happy to have him. But what I like Professor Aline for, he took me aside one day and he said, you know, Minister, new Minister, this NCD thing you all brought up, I think you should take it and run with it. And I want to thank Professor Aline that we have. We have a Fight the Fat campaign, which we started in Trinidad, that targets obesity, targets healthy lifestyle, targets poor eating habits. And we bring it together in such a manner that the country has now bought into the Fight the Fat campaign. And people are exercising more, watching their diet. And I was very happy to hear Dr. Hospitalis speak about salt, trans fats, etc. And I want to put on the table something more. Sugar. The deleterious effect of sugar, and also MSG. When you look at monosodium glutamate, together with sugar, together with oils, mixed together in a concoction that is fed to children, what it does, it stimulates the hypothalamus and causes the lack of satiety. And they keep eating, and they are addicted to this type of processed foods. That is been shown to be correlated well with childhood obesity and, I'll say, adult onset obesity also. And with obesity comes what? Cardiac diseases, renal diseases, and the other diseases that has taken up so much of our health budget. For 10% of the population, of 20% of the population now is taking up 90% of the population of the health budget. So we have to really fight the NCD epidemic as we have it. I've taken that opportunity to plug that in because it's important that we understand that public health is about wellness. And wellness is about proper eating habits and prevention of illnesses. One thing, last but not least, there's an illness that we can't touch, we can't see, but we could feel it, but not feel it. It's an emotional illness. The scourge of addiction and mental illness are two parts of the illnesses that we have to do some proper research on and attack it with full force. Ladies and gentlemen, thank you very much, and I'm very happy to be here at the launch of CARPHA.